Well, I'm going to jump in and get started because I know we have a lot to talk about this morning. So thank you. So good morning, Harbour Club members. Thank you so much for joining us for our virtual business breakfast series on safe business, how we can operate carefully around COVID-19. Before we get started, I want to let you know your mic is muted. If you have any questions today, please go to the control panel on the bottom of your screen and use the chat or the Q&A box. My name is Missie Parker, and I am one of the membership directors at the Harbour Club at West Edge. We have loved hosting this series, and today we're very fortunate to have with us Dr. Edward O'Brien and our moderator, Thomas Heath. To tell you a little bit about Dr. O'Brien, he serves as the Chief Medical Officer for Business Health at the Medical University of South Carolina, where he oversees external business relations, clinical quality growth, and programs for MUSC's $3.8 billion annual economic impact. Dr. O'Brien is also the Executive Director of MUSC Health Solutions, a novel system-wide accelerator for rapid commercialization of innovative medical products, services, partnerships, and ideas. Dr. O'Brien has also been appointed the founding chief of the new Health, Wellness, and Human Performance Center of Clinical Excellence. He additionally serves as a medical director of Physician's Assistance Program at MUSC and is a co-founder and chief medical officer of One World Health. Since 2008, One World Health has built 11 sustainable medical centers in Uganda, Nicaragua, and is expanding to Honduras currently. Servicing well over 150,000 hospital patients a year, Dr. O'Brien has also overseen the telehealth and telemedicine platforms at MUSC that incorporate direct-to-consumer and jails, prisons, nursing homes, skills nursing facilities, specialty services, and employers. And that is only half of his resume. So Dr. O'Brien, we're very fortunate to have you. So thank you for joining us this morning.
Yeah, and I have a question. When do you sleep?
I know. I felt like I needed to do something more after reading this. Our moderator.
Wow, I thought I had a lot of responsibilities.
Our moderator this morning is Thomas Heath. Mr. Heath is one of Southeast's most respected business coaches and personal branding experts. He is a columnist for the Charleston Regional Business Journal, a founding member of Charleston Leaders, a community organizer for 1 Million Cups, a city host for LinkedIn Local, and he sits on the West Steering Council for the Charleston Metro Chamber of Commerce. Mr. Heath is also a guest lecturer at the College of Charleston, the Citadel, and Charleston Southern University on the subjects of branding and messaging. So thank you, gentlemen, for joining us this morning. Really appreciate it. It's a really important conversation. And now I'll hand this off to Mr. Heath.
Okay, thank you. Well, first of all, thank you, Missy, Jim, and everyone at the team at the Harbour Club. I think this is great what y'all are doing in providing, even though we're you know, with all this crazy COVID stuff going on right now, we can't meet in person. So I just want to affirm you for all the value you're creating for members like myself in getting to learn and listen from people like our guest today. So I'm really excited because I got to chat, and he said I can call him Ed. Ed's really just, besides an uber smart guy and does cool things like build hospitals, help build hospitals all over the world, he's very down to earth and approachable. So Ed, why don't you tell us a little bit about your role within MUSC as it relates to what's going on with COVID stuff.
Sure. Thank you. Thank you for the introduction too. By the way, my father was a member of the Harbour Club, so I've been there a bunch of times back when it was over on the other spot. I don't know if it's moved yet, but I'm excited for the new spot. We'll probably rejoin because our MUSC offices are actually in the same building, so I'm excited about getting up there. But my relation to at MUSC with COVID was I implemented the telemedicine platform, MUSC.care, which is the first telemedicine platform to launch in the state for screening for coronavirus, which linked us to our first drive-through testing center, which is the first drive-through testing center on the East Coast. Since that time, I've put together the plan that we just got the $25 million funding from the state for to do rural and at-risk collection sites for coronavirus. And these are in, I guess, either some disenfranchised or at-risk communities. As you know, the virus is a little more prevalent in the African-American community, a little more prevalent in the rural community where testing is not as available. So we're getting those sites up and running and out in the community as we speak. So I do that, and then on the back end of that, we created a new program called Back to Business, which is where we go into businesses and actually evaluate them for risk of transmission of coronavirus, both for their employees and their clients, and run them through a training program so that their employees and clients can feel safe and assured that they're doing the best thing possible.
Well, I didn't even know about that one. That is awesome. So I got to jump on that before I get to some other thoughts. So back to business, is it launched? If what does a business need to do to qualify for it? How do they learn more?
Sure, Back to Business is launched. You'll probably see some articles come out soon. We just did the entire island of Kiowa. We did the resort, the club, and the citizens of Kiowa. We actually did antibody testing for 1,500 citizens of Kiowa just about a week and a half ago. Yes, it is launched. You can just email businesshealth@musc.edu to get information. But we do all sorts of businesses. We've done a business with 5 employees where they really wanted to make sure they're doing things like wearing the right mask or putting hand sanitizer in the right places and making sure they're sanitizing things that people touch. And on the client side and on the employee side, they're making sure, well, how do we stagger lunches? What do we clean with between lunches? So we've done businesses that small all the way to large businesses like the Sanctuary Hotel or the Hotel Bennett, where they want to know how long between guests in each room does it really need to sanitize, right? How long does the virus live on certain surfaces? All that kind of stuff. So we run the gamut, and this is not a big profit center for MUSC. We're trying to do it. We're trying to do it to just basically as a public service. So it's cheap.
Okay. Well, first of all, I know we have a question. We're going to get to that as far as some testing numbers on Kiowa. I just want to say this is really exciting what y'all are doing, because when we were brainstorming, Missy and Jim and I and the team on what would be a good topic, I mean, one of the things that is close to me as someone that has at-risk family members is going, I have a business. I see people in my staff. How do we handle this? How do we protect the people on our staff? How do we protect our clients, that are coming in? And so I'm really, really excited to learn some more of this news. So I want you to just, and I'm going to ask Missy to type this, the email again, because it was a little quick. If you could just give that email, sure. And then Missy will put it in the chat for anyone who wants to learn more. Sure.
It's businesshealth@musc.edu.
Okay, businesshealth@musc.edu. Okay, right. So and this is great. We want some interaction here. So I'm going to imagine the question based on the percentages and numbers. Was there anything revealed out of the testing of the I'm going to call citizens of Kiowa?
Sure. There's about 1,700 people who call Kiowa home full time. About 1,400 or so showed up for the testing. Percent positive rate is actually in the single digit range. I would call it, well, let's see, 2,204, right around 3%, or actually under 3%. So Kiowa is a very, very safe place. They did not have any kind of large outbreak, as you can see. Now, what we'll do is we'll wait now that everything's opened, and we'll go back and retest those citizens in 3-6 months or something like that, and see if those numbers changed quite a bit, and see if cases are being imported. So the numbers that we have now are very promising. If you want to take a vacation at Kiowa, it's probably pretty promising. It's probably a safe place, but we'll see how it goes down the road now that a bunch of other people are coming in. Okay, so hopefully that answered the question. So one of my questions are, as far as staggering, so I'm working with the staff. One of my businesses, I'm the co-founder with my wife, Judy, of the Life Guidance Center. We're a counseling, coaching, therapy center. So we're trying to figure out best practices for, how do we stagger, when employees in the workplace. Do you have any best practice suggestions for us on that? Sure. And I will say another reason that Back to Business is popular is because, and it goes to this, is that, the CDC guidelines are not easy to interpret. And then you pile the CDC guidelines on top of the DHEC guidelines, on top of your institutions or your field of businesses guidelines, and then it becomes this big smorgasbord of things. And what do I pick? How do I choose? So staggering employees returning actually is pretty important. As you know, right now in South Carolina, we're actually getting a fairly significant uptick in cases. We are predicting a larger uptick because of the protests and some of the things that have been going on with larger groups of people. So staggering employees coming back is very important. The way we typically recommend staggering employees is if you have an office and don't feel like you could meet the general requirements, which is distancing of 6 to 8 feet, really more than 6 feet is appropriate. If there's cubicles as opposed to closed off offices, if you have a single air system that circulates the air within your office, and there's no exterior ventilation, those are all things that are important to consider when bringing employees back. The most important thing to consider when bringing employees back, however, is the health and wellness of the individual employees. Now, you can't, according to the law, your employee has to sign over their health problems to you if you want to see that as an employer, and a lot have recently because those are at higher risk. The elderly, those over 65 years old, those with comorbid conditions such as diabetes, even hypertension, heart problems are at higher risk of mortality and having bad outcomes from getting the virus. So those people we're recommending actually working from home pretty much indefinitely until we have a vaccine or some other good treatment regimen. So what I would do is stagger those who would do poorly with the virus coming to work the least and the latest.
Okay. And is there, as far as guidelines and best practices, is this available in like electronic form as well, or does someone have to like go through the program and be taught it?
No, I mean, it's some of the stuff you can find on the CDC website, for example, does have some recommendations for offices, and it involves, I mean, they're pretty intense recommendations. I don't think they take, one thing the CDC does not do is take actual business practice, but they're available.
So, but do you all I think you're calling it Best Business, is that correct?
Back to Business.
Back to Business. Do you all have that in a written format?
Oh, we do. It's not, you could contact us and we could talk about getting it to you, but we do have all that in a, what we do is we go into your business and physically come up with a playbook for you. And we say, listen, here's the CDC recommendations. That is not feasible in your line of business. You cannot open with that. However, here's the best strategy for mitigation that you can do in your business for safety. And then you get the MUSC sticker out in the front saying you've been through the training. Because the truth is this, I think there was a recent study that I saw that 80% of people are still uncomfortable with indoor dining, for example.
Sure.
That doesn't mean I'm not going to do it, but it's high. So you got to somehow get the trust of the business of your clients back. And so that's what we offer.
You know, it's interesting because I was having this conversation with Adrian Kane. For those of you who don't know Adrian, he's one of the leaders at the Charleston Metro Chamber of Commerce. And I said, it boils down to confidence, dude. And he's like, I totally agree with you, Thomas, that like for me, I'm in that 80%. I'm a foodie. I love to go out and eat. It's not happening right now. That's part of why I started Adopt a Local Restaurant. So if you're like me and you like to eat and then get food from restaurants, go to lowcountrylocal.org and go adopt a local restaurant, because all it is pledging once a week to order takeout and delivery from them. That's it, once a week. If a whole bunch of us do this, we keep a lot of people in business. So I want to go back to and if we have any questions, by the way, if you haven't checked in yet, everyone, just let us know who you are, where you're calling in from, and we definitely want to. This is for you. This is not just for us talking. This is for you. If you have some specific questions that would be helpful as far as safe business, how can we operate carefully around COVID-19? So we talked about staggering. I'm going to talk about masks. Now, I prefer to avoid conversations as far as mask, anti-mask. For those of us who choose to wear a mask, what are the components of an effective mask, Ed?
Sure. Well, I'll say this, there's actually a good research study that came out, I believe this week, showing the effectiveness of masking. And that's with any mask. That's with a typical 2-ply cotton mask that people are making and selling currently. And the masks run the gamut from that all the way to an N95, which is what you hear about the healthcare workers wearing when they're exposed directly to the coronavirus. So I'll say this, any face covering, at least a minimum of a 2-ply cotton face covering, is better than nothing. There was an interesting article that if say you're within 6 feet of people, assuming that, and you're wearing a mask, and no one's wearing a mask, your risk of transmission of the virus is somewhere around 20%, 17 to 20%. With a mask, that drops to 2%. If both people are wearing a mask, it drops to around 1%. So it's all about decreasing your potential for catching the virus, and every step you can do along the way to do that is very beneficial, especially if you have other health conditions, or you feel like you could be an asymptomatic carrier and give it to people in your household who have health conditions. So it's not just about you. Wearing a mask is for you and for others.
Great. And again, just, I speak for myself. We want to get into any controversy here. This is the Harbour Club. We just love on each other. So just to make sure I got this right. So from what you have researched or studied or found out, if I'm in a group and neither of us has masks, I have a 20% chance of catching it. If I'm wearing a mask, it might be 2%. If they're both wearing masks, 1%. Did I get that right?
Pretty rough numbers. I don't want to quote the exact numbers. Really, like
I know, but I mean, still,
close enough.
It's pretty compelling argument. It's okay.
It is. I feel like it is.
Yeah.
It is.
Okay. What are some ideas for signage that could be used to encourage? And I want to throw out a term here. I'm not a fan of social distancing because, to me, it's physical distancing, and I am what I say. So if I say I'm social distancing, I'm not being social. That's not what I want to be. Human beings intrinsically are born to be social, most of us. So physical distancing is what I refer it to. So as far as signage, does any of what you're doing have any recommendations that could lower the exposure based on putting up signage?
Sure. We do. We offer signage in the Back to Business, in the MUSC Back to Business program. I think what we've noticed is it's how you phrase the signage. If you phrase it, please keep social distance, just like you said, people tend to react negatively to that because what does that mean, social distance? But if you put, listen, please keep 6 to 8 feet apart because we care about you. We want you to be safe, and we want you to come back. We want you to respect our business. We've noticed that works a little bit better. It's just, it's positive reinforcement versus negative reinforcement, essentially. And then the second thing we've noticed that works really well in terms of signage is physical demarcations. So, putting a little plexiglass up between you and the customer is pretty good. But if you put on the ground actual tape where people should stand, and then that happens to be 6 feet apart, that's even better because people tend to feel like those boundaries are laid out for them and they tend to follow them a little bit better. There's some places in Charleston that do an amazing job of that. I mean, the Apple Store is a great example. If you get a chance to swing by there, you can watch from a distance. They do a great job of it, and some other places. Yeah.
Sure. And so I've hardly gone out at all, but I had to go to the UPS store to send something back, and they had stuff on the floor where to stand. I just thought that was great. Colin, sir, your comment, yeah, absolutely. Truth and accuracy is just as important, and that's part of what we're doing here. And I think it's very abundantly clear that Ed is providing just that. So we had a question from Laura. What about wearing rubber gloves? That's a great question.
So this is actually what's interesting. The most interesting part about gloves, and we've found this in a lot of businesses. So we found a lot of businesses that they're recommending their employees wear gloves. Well, gloves can be a vector for virus spread, actually. And there's some interesting studies out there that show people who are wearing gloves have a slightly higher chance of transmitting disease from surface to surface because they feel the gloves are protective. Now, the gloves do protect the person, right? If I'm doing a swab on someone from coronavirus, I need to wear a glove so that the virus doesn't get all over my hands and then I, touch my face or whatever. But the truth is, very frequent use of hand sanitizer and hand washing is probably superior to gloves. And if you are wearing gloves, even rubber gloves, you need to use hand sanitizer on the gloves and actually wash the gloves between surfaces or touching people who may be infected. So the gloves are a bit of a tricky thing.
Yeah, Laura, great question. So let's talk about disinfecting. So I believe the number is you want at least 60% alcohol or higher in any type of hand sanitizer. Is that correct?
That's right.
Okay. So are there best practices for as far as I'm it's a back to business. Am I saying this right, man?
That's right.
Back to business. Yeah. Okay. That's great branding, by the way. It reminds me of if any of you read about the white glove certification that the Explore Charleston is doing, where they go in and they certify hotels and restaurants, whatever it may be, that they've met certain criteria, which includes decontaminating workspaces, and that's geared towards, again, giving consumers confidence. So best practices for decontaminating workspaces, anything you suggest there, Ed?
Sure. I mean, I think the most important part is using a solution that's approved by the CDC, and there's a very easy list that the CDC puts out of substances that are approved. Some are bleach related, some are other substances. Sodium hypochlorite is one of them. I think the most important is the frequency. Yes, you have to use the right substance. Hand sanitizer, for example, does have to be higher than 60% alcohol to effectively kill the virus. You know, make sure you're keeping it on there make sure it dries. That's how it kind of kills. Same thing with soap and water. Make sure you wash for at least 20 seconds to kill the virus and get it off. And really, it's about, you know, how do you limit contacts with surfaces so that you don't need to use as much hand sanitizer, and also how do you make sure that you're using the hand sanitizer between contact with potentially contaminated surfaces in a frequent manner? That's the most important part. And by the way, the white glove, we work with them on that. So coming up with that.
Yeah, great work. So I want to be respectful. Someone had, it's kind of along these lines. I want to make sure we have an answer to it geared towards accuracy. Is it true that the CDC no longer considers there to be a large risk from transfer on surfaces?
So that's interesting. So if you read the CDC, the actual updates that they post, which are not exciting reading, but we read them, and they actually did not change what they said about surfaces significantly. What they basically said, and the news picked up on this, is that you are more likely to pick up the virus from a respiratory route. And that makes sense, you know, coughing, sneezing, all that kind of stuff, you breathe it in. However, the risk of touching a contaminated surface and then touching your face, nose, mouth, whatever, and getting it is still essentially as high as it was before. They just wanted to really point out that the respiratory method is the way you get it. Now, there's some emerging data showing that the virus probably doesn't live as long on some surfaces as originally thought. There's some good data showing that sunlight and heat are not good for the virus survivability. So in that sense, I would say your chance of getting it from touching something are decreased now that we're in the summer months and things like that. However, it is still a possibility, so I wouldn't negate that.
Okay, thank you. So I think this, Laura, too, is checking temperatures. In checking temperatures, what is the red flag number of compromised people? So I guess what is there a certain percentage of, if we're checking temperatures, do we need to get nervous if a certain number come back with high degree of temperature?
Yeah, I mean, checking temperatures is tough, you know, and we're about to be in July and August here in Charleston, and everybody's going to have, if you walk outside for a little bit, you'll have a 99 or above, which is not uncommon. Checking, you know, I'll say this about temperatures. If you're using checking temperatures as a true screening tool to root out everyone who has coronavirus, it won't necessarily work because only 60% or so of people with the active coronavirus have recordable temperature at any given time. So it's a little bit challenging in that regard. I would say, you know, the red flag number for people, I mean, is 1. So if you have one person with a fever, they can infect, you know, 3 other people, and then it cascades. So if you do have someone with a fever, that person needs to be isolated and tested, and they can get tested same day at MUSC.
Yeah, so let's talk about that. So I, early on, because I have a grandson with compromised lungs, I went to the mall and attempted to get screening. They said, no, you gotta go on the app. And I think I had a dry cough, which at the time was indicative of a symptom. And at that time, and I'm not blaming you on what you're doing is great, I got denied. So I just wound up going to Holy City Med and paid my $80, and 3 days later I came back negative, thank God. So if someone really just wants to go tested, is it going to be hard to get tested at MUSC?
That's a great point. I'm glad you brought that up. So originally, testing we were pretty strict about it, honestly. We were following extremely strict WHO and CDC guidelines for testing, and capacity was not at the level it is now. We've more than gone up more than 10 times in our capacity. We have one of the most accurate tests in the state as far as swabbing for PCR, for the virus. And now the criteria for getting tested is extremely light, because now we know, listen, there's a lot of asymptomatic people out there. There's a lot of people who have the virus who only have lost their sense of smell. I'm sure you've read about that. A lot of people who just had a headache a couple days, a little bit of runny nose, and they got the virus. So now we're pretty much, if you pretty much put a symptom on there now, we're going to test you, and we're going to get it really quickly. Our labs also got quicker. Results come back within a day now, actually even faster sometimes.
That's great. So good question from Betty Parker Ellis. I'm an independent contractor to my main client who's not yet reopened. What trends are you seeing for allowing service providers like myself back on site? So I'll let you go. I have an answer for that.
I'm sorry, what was the service they were in?
So she's an independent contractor, and her main client hasn't reopened yet. I guess the question is, for those that are starting to reopen, are you seeing anything with allowing non-employees but independent contractors come on site?
I am seeing a little bit of that. I will say this, that the majority of employers, that's going to be the last thing, one of the last things that they allow on site, because they have less control over self-monitoring and things like that. So I'm seeing that come a little later.
Yeah, same here. I mean, as someone who works independently and a lot of times would go onto my client's site, it's just not happening as much anymore. So yeah, I get, it's a bummer, Betty. And a lot of it is just getting creative. For me, I'm going to speak for myself, and pivoting some of my business and my revenue streams and my approach, and being a little smart about marketing and building and marketing my authority to other folks that don't need me to go in. So, okay, so keep your questions coming. These are great. We've got a whole bunch of time. So, okay, let's talk about as far as how would you advise an employer to handle workplace protocols? In other words, setting them up, including if an employee doesn't follow the rules. Any best practices on establishing protocols, including how to handle someone that's just not following them?
Right. I think, as far as setting up best practices and protocols, I really recommend making, and this is what we do at Back to Business, is make a playbook. It's hard to get every potential contingency in a playbook. The ones we do are pretty intense. They do get most contingencies. I would recommend some very key things in the playbook. Make sure you're following the basic CDC DHEC guidelines. Make sure you're listening to someone like an MUSC who has epidemiology data that is reported on a weekly basis for free on our website. Make sure you're following the trends in the community. Are the cases picking up? What kind of people are the cases picking up in? Is it picking up in my neck of the woods? Are these kind of people coming into my shop? So make sure you're following that, and then have a mitigation strategy. So if all of a sudden you have an employee who gets sick, make sure you have a contact with an expert like an MUSC. And that's another thing we do. We have a liaison who stays with that business throughout this pandemic that you could call or text. It's an epidemiology trained nurse or doctor that you would just call and text and be like, hey, I had 2 employees go out sick. I'm sure you saw a downtown restaurant recently had, I think it was 2 or 3 employees in the back of the kitchen who were sick. So then you would contact MUSC and we would say, hey, is this something we can go in and mitigate within 24 hours, clean everything out, test all your employees quickly and get back to business, or do you need to close down for a few days? We did not recommend, we were not part of that restaurant, although they did close down for a week. But mitigation strategies are really, really important. And testing, rapid access to testing and seeing the test, at least in aggregate, for your business is important as well. Sure.
I mean, again, this Back to Business, I just think is brilliant. So I want to affirm you for any role you played in that. How does what's the pricing? How does that figured out as far as what a business owner needs to budget to hire y'all?
Sure. Honestly, the pricing, we're just trying to cover our cost of our experts coming out and looking at the business. It's really variable. If you have a very, very small business, honestly, it would probably only cost you a few $100s. We're trying to keep it very cheap and accessible.
Sure.
It would not be a large capital expense for your business, even if you're small. larger corporations and organizations, it just goes up into the few $1,000 range, you know, for the playbook. And then sometimes if our back to business employees need to spend a lot of time out there, we're just paying their hourly rate to have them spend a lot of time and do a lot of walkthrough for your institution. So it's extremely affordable. I don't want to quote exact prices because
no, it's great. I mean, I got my answer, which is it's affordable, and y'all are not running. You're running this more like a community service, covering your costs, than you are as a profit center, and I just think that's amazing. So, is this launched yet? So first of all, has it launched yet officially?
Yes, it's officially launched now. Yes.
Okay, so I read a lot. I haven't heard about it. So what are you doing, or what can we help to get the word out? Because this is good stuff.
Sure. Well, we're just starting to get the word out now. In full transparency, we had to furlough several of our marketing people.
Okay.
So they're coming back now. The hospital is getting really back in to full normal operations, which is excellent because, as you know, we had very few cases at MUSC. So MUSC is a safe place to come for sure.
Mm-hmm.
So we are working to get the marketing out right now. Honestly, just word of mouth. We've had quite a number of businesses sign up. So we haven't felt like we need a massive marketing push yet, but we'd love to help more people.
Sure. Okay. Well, a lot of us, myself included, we're marketers. That's what we do for their branding and messaging. So let us know if we can share a graphic or something that we can do with our followers to help get the word out. I definitely would love to see someone create a video around this, because videos are so effective in telling the stories. So, please reach out to any of us if we can be assistants, because this is real. This is something that I'm hearing besides the white glove, which is great, what Helen's doing over there. This is not specific to hospitality. This is for everyone, and I just think it's awesome. So, okay. Don't see any new questions. I'm going to keep going with some of the ones that were submitted, but please, again, this is for you, not for us. We want to make sure that we're being in service and educating you as much as possible on safe business practices. So, okay, so this is an interesting question. It's open-ended. What have we learned different from the beginning of this virus to what we know now as far as COVID-19, Ed?
Well, I think we've learned how to root through a lot of conspiracy theories. I've certainly spent a lot of time doing that. I think we've learned quite a bit. I think a lot of people, I have this kind of theory that I don't know, that the incidence of the virus has been low, obviously, overall in our area, as opposed to like a New York, right, or Northern Italy or something like that. I think we've really learned that this virus tends to kind of hotspot. It really tends to spread in crowds relatively rapidly. So we've learned that. We've also learned, who's at higher risk. I saw some data that came out yesterday about the 106,000 people who have unfortunately passed away from the virus, that almost 40% were nursing home patients, which says a lot. I mean, these are estimates, obviously, but so we've learned who is at highest risk, I think, to quite a large degree. I think we've also learned that there are a large number of people who are asymptomatic or minimally symptomatic, which is probably more accurate. Minimally symptomatic meaning, I just had a headache or lost my sense of smell for a couple of days or something like that, but you wouldn't necessarily go to the doctor for that normally, right? So there's a large percentage of people, I wouldn't say an overwhelming percentage, but it seems to be a decent percent, and those people can spread the virus too. So I think, we've learned a lot. And as far as treatments go, we've learned quite a great deal. You've heard the controversy over hydroxychloroquine. I just use that as an example. That's the one that I believe President Trump is taking. And that the articles just came out in Lancet New England Journal of Medicine that the data they used to say that it wasn't effective was flawed, which I've never seen the Lancet New England Journal of Medicine retract a peer-reviewed publication like that, but that's in process of happening. So we have found some other promising treatments. We know now not to try to put people on ventilators early. We know now that convalescent plasma is helpful. These are all things we're doing at MUSC. We're still continuing to research several other treatments. We know remdesivir from Gilead appears to be effective, and there's some other drugs that have some promising, futures as well. So I think we've learned quite a lot. I think South Carolina is doing a pretty good job on contact tracing, which is important. and so we're getting there on that. And we're also, I mean, we've learned to wear masks and to physically distance ourselves, which is massively important. So we're making a lot of progress, and the vaccine progress is also happening at an incredibly rapid click. So we're excited to see where that goes as well.
Sure. So that's a good segue, because I was thinking vaccine, because so I read something, I don't know, 2 weeks ago that I think it was the UN shortlisted like maybe a little bit more potential vaccines. My gut is based on just how quickly we develop things nowadays with technology, that this is not going to be as long as it used to take to develop a vaccine. With that said, I haven't read anything lately. Any updates on a vaccine?
Sure. I think you're going to see. I'm with you. Full disclaimer: I'm an optimist at heart. So, scientist optimist. I don't know if that's a thing, but I have some updates on the vaccines. I think Moderna, the company, is working on an mRNA vaccine, which is a new type of vaccine. Is entering phase 2 trials, which is amazing. Which means that they're actually inoculating quite a large number of people. I believe it's in the 1,000 range with the vaccine, because it was proven safe in a small number of people and effective. So that is a big one. I think Johnson & Johnson has one. Pfizer has one they're working on. And then the other big one is, I think it's AstraZeneca. I can't remember. But they all have really promising. And what they're doing, which is different than vaccines in the past, is in the past, you go down this pathway of animal testing, right? Small human trials, large human trials, wait for the people to be exposed for the disease to see the effectiveness of it, and then produce, right? Now they're doing simultaneous large-scale production as they complete the trials, which is very, very promising. And so I think a lot of older school vaccine people out there are saying, we can't have 100 million vaccines by December. Well, I don't think they're really following the supply chain as closely as they maybe could, which, to credit our current administration and the CDC and the WHO, they have really pushed, and Bill Gates' organization actually as well, have really pushed, simultaneous ramping up of production as the research is going on, assuming that it will be positive. Now they're gonna have some misses, but they'll have a hit, which is really important.
Yeah, I mean, what's hopeful, for lack of a better term, for me is, last I checked, it was phase 1, and you just educated us that they're, at least for Moderna, I think I'm saying it right, they're on to phase 2. So that's kind of cool. And what I feel good about is, it sounds like most of these are U.S.-based companies. We gotta start manufacturing our stuff here, because that's a lesson learned, I think, as far as medicine, gloves, masks, supply chain in general. We rely way too much on other countries that some of them aren't, I don't know, I'll just leave it at that. We rely too much on other countries. So,
right.
Okay, cool. Let's, that's great. Well, I think it's great. Y'all are, if you can give, let us know, in the comments, is this good? I mean, are you learning stuff? I am, at least. So I'm going to read this, another question. Right now, South Carolina has over 10,000 cases reported. Do you know how many active cases there are? What is the reasoning behind reporting all cases versus active cases?
I think that's an excellent question. So we estimate about 66% of cases are old. So the way MUSC keeps records is we keep, we're doing a lot of testing. Obviously, we've done almost 50,000 tests. We're doing a lot out in the rural communities now as well. And we classify ours as, when this test was taken. Is it 1 week old? Is it 2 weeks old? Or is it 3 weeks old? We know the majority of patients will be completely cured within 3 weeks, obviously, right? The overwhelming majority. I would say, here's what I do when I see the DHEC data. I take that data and I multiply it by 0.3, basically 30%. And I say, that's the number of active cases who are out there, in theory, potentially spreading the virus around or actively sick. So they estimate about 67% or so are old or are healed of the virus. I agree with you in the reporting. I think that's a bit misleading, the way it's reported. I wish they would report it, but they're getting better. Honestly, the website's getting pretty good for DHEC, so you can always go to that and get some breakdown of the data.
Yeah, and that's interesting. I think that's pragmatic number saying, you know, it's probably at least 30% underreported. I think that's good. It'd be curious because I know we just recently had a spike. You know, don't know what's causing that, if the lack of physical distancing. It's going to be curious. So, you know, I think one thing about that I've learned from like watching, I think Dr. Michael Osterholm, am I saying it's right? The scientist out of Minnesota, he's amazing. Is that this virus is acting in a lot of ways that other viruses in the past haven't, and it's a little unpredictable.
Mm-hmm. That's right. And the spikes we're seeing in South Carolina, a lot of people are saying, well, MUSC's got these testing centers all out in the rural community, and so does DHEC, so we're testing more people. So of course there's going to be more cases. That is true. We're looking at the percentage positive as well, though. So, you know, if you're testing 50 million people, you know, and you got 10% positive, right, versus testing 100 million people and 2% positive, I wouldn't say the 2% necessarily is an increase in cases, right? So we're looking at an increase in prevalence and incidence. We're seeing an increase in both right now. An interesting number, and again, if you want to kind of, if you like diving into these statistics, which I do, is really follow the hospitalization number closely. So, and I've noticed this in Italy, you know, for whatever reason, and you might have seen this in the news, some Italian doctors came out and said the virus is mutated, it's not as deadly, it's a different virus now. It's fairly, I mean, the data they use to say that is obviously not actual genetic data. It's just anecdotal and observational data, and they're saying, hey, listen, you know, a lot of people still have this virus, but why are so few people in the hospital now? Why do we have so few people in the ICU or on ventilators? So that's something to watch. I mean, it's certainly possible the virus could mutate to something we obviously all hope less deadly. I don't have any evidence to say that, but those are things, if you really want to get down into the weeds of the data, to watch the hospitalization rate. So if the numbers of positives climbs exponentially, but the hospitalization rate does not, that's interesting. That's not like it was headed early on. So there may represent a change either in the people, you know, who are getting the virus or the virus itself.
Sure. And I just want to be respectful. This question was submitted. I'm pretty sure I know the answer. Some are reporting this as a disease, others as a virus, if there's a difference. So what, this is a virus, right?
Right.
Okay, got
Correct.
it. So, okay. Do you have any advice with regards to businesses and nonprofits gathering large groups together? So whether it's, I don't know, theaters, houses of worship, any thoughts on that happening or not? If it does, when? If it does, how? Any thoughts on that? Again, I want to be respectful to the question that was asked.
Sure. I think certainly larger crowds are your highest risk. I think a good point of that is, I mean, hey, Charleston, what we're known for tourism, but weddings, right? I mean, that's a perfect example. I mean, we are a wedding destination. So we actually are working with some wedding venues now to try to come up with strategies to safely have something like a wedding, which typically is a larger crowd, 50 to 100 people. It is possible. Obviously, I'll say some anecdotal great tips for that would be to, you know, if you can have it outside, amazing. If you can ensure everyone is wearing masks and socially distancing, you know, amazing. If you can make sure that the food service, for example, is not buffet style where everybody's touching the same utensils and all that kind of stuff, even better. But make sure to protect both the employees working the events as well as the people who are coming to the events, because it only takes, you know, one super spreader, they call them, to spread to a large crowd. I think those things can happen in the near future. I really do. It's just they're not gonna look the same, nor should they. And I do think they're possible. So that's another thing we do. We've done graduation services in Back to Business and wedding services, oyster roasts, things like that, to really ensure safety. Mm-hmm.
That's great. That's great. So bring it to the Harbour Club. I want to get back to business. So now this says it's from me, but I'm pretty sure it's from John Stroud based on his log. And he said, this is not meant to be a political question, yet logistical. Will we ever be able to trace it back to the origin? So it doesn't happen again? And so I think that is a logical question to me. What I have heard is the wet markets. I think in China, they're saying that this transferred from I forget the bat's name, from a bat to animals in the wet market to humans. What are your thoughts on that? I mean, I don't even know if that's accurate, but that's what I've heard.
Sure. I mean, that's what's coming out of China. That's what they're saying. A lot of experts are saying that. There's other people and a little bit of data pointing to that it could have gotten out of a laboratory. I certainly do not believe that this was intentionally released into society. I think ways to make sure it doesn't happen again and where did it come from. I think we'll be able to get pretty close to the origin. There's plenty of examples that I've seen so far that show the first cases were not actually at the wet market. They were other areas of the town. I don't know what that means. I think China being non-transparent with their reporting and their data, and they're allowing organizations like CDC and WHO to research it. I don't know that we'll get the truth that everyone's looking for ever, just because they're a relatively closed society in terms of that. So I don't know that we'll ever get the exact data that we're looking for. We'll make our best guess. I think how do you make it sure it doesn't ever happen again? I think, shutting down the sale of live animals in a wet market is pretty basic. That's one way. The second way is making sure that you have appropriate lab safety. So we know that the Chinese government virology lab is in Wuhan, and we know they're researching this virus as well as other viruses. We're doing the same thing in the United States, right? And Europe's doing the same thing. So really making sure that that what you're researching doesn't escape somehow, or that the safety practices in those institutions are well above board is the most important part.
Yeah, great question, great answer. Betty, thank you for the kind note. Appreciate it. So we have around, I'm going to say we have around 2 minutes or so, 3 minutes before we bring Missy back on to fill you in on what's going on at the Harbour Club. So if you have any questions, type them in. I'm just going to go through my list. Yeah, so I don't know how short this answer is, but I'm going to ask it. How is MUSC preparing for potential second wave? That's the question.
Okay. MUSC is very, very well prepared for that. We have sourced our supply of protective equipment. As you've read, probably people were having shortages of masks and things like that. So we've shored up our supply of that. Our doctors are ready. We're well trained now how to isolate people. Our emergency department is well trained how to isolate people appropriately. We have the ability to flex up and down beds should we need those. And I think just our community testing centers and our off-site testing centers are running at a very, very, very high clip. And we're getting testing and resulting back a lot faster. The final thing MUSC is doing is really research. I mean, we're researching the convalescent plasma program, the new drug therapies. So we're on top of it.
Yeah. So, and this has just been eye-opening to me. If you just put in the comments, and thank you, Laura. Yeah, we got to thank you, Ed. Wow. And, I think as John has said this, it was nice to be part of a level-headed conversation that just, people talking, trying to learn, be in this together. And it was very, very enlightening for me. So if any of you have time, maybe just type into the comments, what's your one takeaway that you got out of this that maybe you didn't know before? I just think it would be enlightening. For me, I just got to go back to business. I mean, I just think that is awesome because I want to be safe. I want to get the economy going. I want to open up my business. We will be reaching out to you because I want to do it right. I want to protect my staff, and we want to protect our clients. And if we can get any guidance, especially affordably, wow, that's just huge. So thank you for that. So I'm going to pass along to Missy. Ed, thanks again, man. You're awesome. Really appreciate you. Missy, thank you and Jim and everyone at Harbour Club for getting this conversation going. And we should just record this and put this on the news. I think people will learn from this.
Well, thank you very much. I look forward to meeting people in person.
Yes,
Great.
we look forward to it too. Thank you so much, Dr. O'Brien. I also express those sentiments. I mean, this was a very informative conversation. I think it's really important. And then we put this on our YouTube page and then push this out to the members that couldn't make it this morning. So I think there's a lot of questions that were answered, and you hear so much disinformation. So thank you for your time. And then just a reminder, so the Harbour Club is opening June 15th. So we are very excited. Furniture was delivered yesterday. So hope everybody marks their calendars, and also we'll take reservations starting next week to come to the club. So we are practicing social distancing, reservations only for at least the first week to make sure we monitor the amount of people that come into the club. But look forward to you being a neighbor, Dr. O'Brien. So thank you everyone for your time. It was very valuable, and appreciate it, and hope everybody has a wonderful day.
Thanks everyone, take care.
Thank you.